Welcome, everyone. My name is Francesca Iacorto. I am an advisory board member of the Pearson Centre. I'm also the Senior Director of Public Affairs at the National Airlines Council of Canada. As many of you will know, the Pearson Centre is a progressive centrist think tank that addresses the big economic and social challenges of the day. In that context, I am pleased to welcome you to the fourth webinar on major policy issues related to COVID-19 and how they are affecting our society. Today, we will hear from ambassadors about how other countries are dealing with COVID. As this pandemic works its way around the world, today we will hear from countries that got the coronavirus weeks before it came to Canada and therefore may be ahead of us in dealing with it. While we are not going to cover COVID in every country, we are planning another webinar in a couple of weeks on COVID in South America and Africa, where we will also explore the role of international development and multilateral organizations in combating this pandemic, where they have yet to reach the peak. I also want to tell you that the next webinar we will be hosting will be care and long-term care homes, which is very sadly a very topical issue. This event will take place on Monday, June 1st. The panelists will include the heads of the Ontario Long-Term Care Association and the Ontario Nurses Association. Please register as soon as you can. I also want to take a moment to thank two sustaining sponsors whose help these sessions would not be possible. They are, first, Canada's Building Trades Union, and second, the International Association of Firefighters. Now back to today's panel. We have four very knowledgeable panelists who will address us, and I will apologize in advance if I mispronounce any of their names. We will be starting with Her Excellency Sabine Sparwasser, who is the Ambassador of Germany to Canada. We also have His Excellency Yasuhiro Kawamura, who is the Ambassador of Japan to Canada. We also have His Excellency Urban Alin, who is the Ambassador of Sweden to Canada. And last but by no means least, we also have Mr. Winston Wenhee Chen, who is the representative of the Taipei Economic and Cultural Office in Canada. I'm also delighted to tell you that our panel moderator today will be Michael Levitt, who is the Member of Parliament for York Centre. Very appropriately for the discussion, he's also the chair of the Standing Committee on Foreign Affairs of the House of Commons. Ambassador Sparwasser and Mr. Levitt, you have both spoken on the Pearson podium before, so a special welcome back to you both.
Thank you.
With respect to the format, the panel discussion will last about 40 minutes and will then be followed by a Q&A period moderated by the Pearson Centre President, Andrew Cardozo. And we will endeavor to end promptly at 3 p.m. Eastern. Please use the question box on your screen and we will get as many questions as we can. This session is being recorded and will be posted on the Pearson YouTube channel later on this afternoon. Well, with that, over to you, Michael Levitt.
Well, thank you very much, Francesca, and I want to thank the Pearson Centre for inviting me to be the moderator of this panel with some really special guests participating. I also want to thank Andrew Cardozo for his leadership of the Pearson Centre, and Kathy, who has been the producer of this event. As many of you out there will know, from participating in various webinars and online seminars over the last couple of months, it's a new world. It's a new world in terms of engagement, and the technical gremlins that can pop up are many. So the fact that we're all here and starting on time, and again, we've got a fantastic panel of dignitaries. I'm really pleased to have been asked to participate. It's clearly unprecedented times around the world, and as Francesca mentioned when she introduced our participants, each of their countries has been engaged in dealing with the pandemic, dealing with COVID-19. Some have taken different approaches. There is clearly lots for us to discuss in the next 40 to 45 minutes. I want to begin by saying it's certainly unusual times for our diplomatic guests that are in Canada, for our ambassadors. These are not normal times, and I want to start by saying to the four of you that thank you for all you're doing here in Canada, participating in events like the one today. But I know it's also challenging times for each of you. I'm sure you've each got family and friends back in your countries that are being impacted, and it can't be easy to be away from home at a time like this. Again, normal life in Ottawa is certainly not the same as it was several months ago for all of you. So I think certainly maybe we can discuss, that later on in the discussion about what it's like now. What is the new normal for you in your roles, and how is that playing through? But I think what I'd like to begin with is just for background, a sense from each of you how this pandemic has impacted your countries. The time frame, as Francesca said, different countries have had to deal with the challenges of COVID on a different timeline. So maybe Ambassador Spavasser, we can start with you, and you can give us kind of the lay of the land, the background on how this has impacted Germany.
Thank you so much, Michael. Thank you very much, Andrew, for inviting me again to the Pearson Center. Germany is, as you rightly said at the beginning, is a little ahead on the infection curve, if you want. And in many ways, I think this is for Canada a real advantage, because you can look at us a little bit as the canary in the mine shaft. You can see what works, what doesn't work. In Germany, we had the first case of corona in January, sort of middle of January. And these were cases of people having gotten infected skiing mostly. And then by the 22nd of March, we were in complete lockdown. So ever since, this has meant 181,000 people being infected. It has meant that 8,372 people have died, and it has meant that the whole country has been sitting in lockdown, and our economy has taken, like everybody else's economy, has taken a very, very serious hit, and Germany is now officially in recession. So this has been a very, very rough time, and our government has had to make up the reaction on the go. And I have to say, what happened in Germany, and that may be also something we can discuss later, has shown that in countries where the leaders are communicating, where they have science-based decision-making, where they come out and are very transparent, the lockdown actually works better, and they seem to do better. And so in Germany, the lockdown has been widely respected. By now, our infection numbers are receding. So the reproduction number, so the number of people that every new infected person infects, is under 1. It's 0.74 or something like that. Which means we can open up. And it means we can open up as a federation in every province separately, and everybody takes the decisions separately. But by now, shops are open again, beer gardens are open again, essential businesses have been operating a little longer. And people are being able to see each other again in a limited way, with a lot of distancing, with the recommendation of wearing face masks, and with a prohibition of larger gatherings. That's where Germany is. I would say, though, on your subject as a whole, I think we should have this webinar again in a year, because in a year's time we'll know what has worked best, because it's very early days, and we will have to be very careful not to ease restrictions too early in order not to have snapbacks.
Thank you very much for that. And if we can now maybe move to Ambassador Allen, can you talk us through a little bit about the approach that Sweden has taken? Because I know they've taken some different approaches in terms of at the early stages, and I think that would be an interesting kind of contrast for us to hear.
Thank you, Michael, and thank you for having me on this webinar. In Sweden, we were affected at the same time as Sparvasser, the German ambassador, is staying. We had people going to Italy and Austria for vacation on ski holiday, and when they came back, the disease spread mostly in Stockholm. So in the beginning of March, we saw a number of infected people increasing very much, but we didn't have a total lockdown like my German colleague talked about. We had more of a kind of a soft lockdown. Of course, it was physical distancing. We need to wash our hands. The public health agency was out very clearly telling people that this is dangerous. We need to protect our vulnerable, the old people, and so on. But of course, there is a difference from other countries. And I think mostly that we still have our kindergartens open, our schools are still open, not for universities and so, they are doing online courses, but up to 9th grade is open. And as kindergarten is also open, businesses are open, but of course in a way that minimizes the risk of spreading the disease. Restaurants are open as well. But at the same time, people are not moving around. The health agency and the government has told people that you need to be careful about not traveling too far. You shouldn't be at any big weddings and activities like that. So we had a more soft lockdown. And at the moment, we have more than 4,200 people that have died from COVID-19. Most of them are from our elderly care center because as it is here in Canada, the virus has spread into the elderly care centers, and that is the main reason why so many people have died. And Sweden is at the late days, we are actually the country that has the highest death rate per capita in the world. So of course it's a question in the Swedish debate as well. Are we doing the right thing or are we not doing the right thing? What I can say is that the public support for the policy from the Public Health Agency and the government is very strong. I think it is based on exactly what the German ambassador said earlier, that they have been very clear and open to the audience that this is a dangerous disease. We think it's going to be a very long time that we need to be in this soft lockdown. And they have been very open about saying that we don't think we can have a hard lockdown because people will not, you know, they will not be able to do it in the long run. So the Swedish government and the health agency have said that this is going to take a very, very long time. And that's the reason why we need to have a little bit of a softer approach, because being tougher will not maybe work in the long run. But as Sabine said, who knows? Maybe there is no best practice when it comes to fighting COVID-19. It's a virus we are talking about, and maybe it will affect everyone around them. The good thing in Sweden is, though, that the curve is flattened. The hospitals has never been overcrowded. We have had enough of intensive care units to take care of everyone that goes to hospital and needs to go to the hospital. The kids are still in schools, they are studying and so on. But there is absolutely a high number of people that have died. And there will be, of course, a lot of discussions about the strategy in the future in Sweden as well. But as Sabine said earlier, we don't know the answer to the question in 1 year or maybe 2 or even 3 years, when we can see what the different countries' results has been, if there will be any best practice actually.
Thank you very much, Ambassador. And I think you raised the issue of the impact on seniors and long-term care. And I heard it's something that the Pearson Center has an upcoming webinar on. I think maybe later on we can have a discussion, because I know that's been, having spoken to many of you over the last couple of weeks, that's been a big issue for many of the countries. Canada, you'll have seen from some of the reporting yesterday, there's been absolutely tragic consequences for our seniors, especially in long-term care. So that's maybe something we can come back to. But Ambassador Kawamura, can you shed some light on how the situation has unfolded in Japan?
Thank you. First of all, thank you very much for your invitation to this webinar. To tell you the truth, this is my very first time to be part of the program. I'm so honored and I'm so excited. Well, the current situation of Japan, as of May the 24th, how many days ago? 2 days ago, we had 16,581 patients, and out of them, 830 died. And well, over the past almost 2 months long, a state of emergency was declared. The Prime Minister declared a emergency nationwide, and all of the 47 prefectures, including Tokyo, were under the state of emergency. So the major cities, as well as the local towns and prefectures, all of Japan was under the emergent situation. But the only difference from the measures taken by the European colleagues was that we don't have legally binding enforcement power on the side of the government. So we took the similar approach to the Swedish ambassador just mentioned, that will urge the whole nation to cooperate with the government guidelines, especially just before the highest travel season in Japan. That is these first 2 weeks of May. That is the best season for doing that. And usually we have exodus of people out of the big cities to the countryside to enjoy the scenery and so on. But targeting at this particular period, Prime Minister Abe declared and urged the whole nation to stay home. Thanks to the responsive reaction from the all part of Japanese people, they stayed at home. So the reduction rate of the tourists and shoppers during this Golden Week was between 70 and 80%. So 70% decline of the people in the house during this period. Thanks to this action, I think we attained the goal of reduction of new infections rate from the peak time of 714 of mid-April to less than 50. This is a daily new infection number. So it was a substantial reduction, a decline of the new infection rate. And more than 13,000 patients recovered and out of the hospital. And medical systems, including hospital beds, now we calculated enough number stock of hospital beds to accommodate the patients of serious. And now the cumulative number of infections reducing to around 0.5 per 100,000 people in the most recent week. So this means that we can focus on the tracing the cluster, infection cluster people. So we got more freedom measures to concentrate on those infected special groups. So we lifted the nationwide state of emergency on a 25th, and Prime Minister declared that we're entering into new normal of our lives. So, but you know, this is not 100% resolution of the issue. as my previous speakers mentioned, that we need to be, say, in highest caution, and we need to reopen the economy and social activities with highest attention, so that the second wave or so that the third wave of infection not come back. The impact on the economy is not a small thing. Like other major partners, our GDP for the first quarter of 2020 was minus 3.4%. And we're expecting more difficulties in the coming months, the second quarter. And Sabina mentioned that what was the crux of the, say, efficient management of the pandemic measures. Well, I agree. The political leadership and effective communications based on scientific data with the whole nation is quite important. And I think, judging from the previous 2 months experiences of Japan, our Prime Minister did his best to communicate with the whole nation, urged the people to stay home. It was effective. They cooperated. No 3 Cs, conference, and connection, and congestion. Those 3 Cs were avoided. So they cooperated, responsive reaction was there. So such a communication together with the leadership was quite important. So we've learned. But at the same time, we have to compare notes with our colleagues, including Canada, Germany, and Sweden, so that we well prepare for the harsher days to come back. Thank you.
Thank you very much, Ambassador. And now, Representative Chen, I want to turn to you because Taiwan has been rightfully widely lauded for its response and its approach in dealing with the COVID pandemic. Can you give us just an overview of what the situation is in Taiwan and how your country has been dealing with it?
Thank you, Mr. Chairman. Distinguished panelists, I feel delighted and honored at have the invitation of the Peer Center. I love to share Taiwan's experience with everyone. I think the people ask about the situation in Taiwan. I think there is no magic. It's well preparedness, and the reason that we have that kind of sense of preparedness is because we have been hard hit in 2003 because of the SARS. And at that time, we lost 73 people's life. And from that day on, we have a strong commitment. We have to prepare. We have to well prepare this day. And I think that's the reason why up to today, the confirmed cases in Taiwan is a population of 23 million people. It's only 441. And the number of the deaths is 7. And I think there is, as I said, the early proactive preparedness and the centralized whole of government's commitment and the get the trust of the people. So the government used a lot of communication. 2 o'clock in the afternoon, the health minister have a daily briefing. So that's a must for the local population. Everyone sit down and watch the TV to listen to what the minister is going to say. And because of that confidence and the trust, so the government can try to use a very effective approach. And the people ask from time to time me about how about the people's freedom and the liberty. I think that's very important for the democracy like Taiwan. How to secure and not to compromise of the civil liberty, even in this period of pandemic. It's a big problem. So that's the reason why government have to be, every approach have to be very transparent make sure get the majority consent, and then they don't have to worry those different, which is extremely important in a democratic society. And also the Taiwan is able to apply the big data and then information technology to tracking the guaranteed quarantine person, which can effectively limit the community transmission. I think that's the reason why even today in Taiwan, there is already 14 some days there is no domestic confirmed cases. So to some extent, we have well controlled the situation. And talking about the economy, I think each year we have 50 million citizens went abroad for the sightseeing, including this country, Canada, and the more than 10 million tourists come to Taiwan. So for certain industries, certainly it's a big hit for them, and including the transportation, tourist industry, and so on and so forth. So how to recover the economy, I think nowadays is our government's biggest challenge. And compare with other countries, we I think months ago, we already flattened the curve. So the school children, they go to school every day, and the business open, restaurant, as long as they can keep the appropriate social distancing, and then they can do business as always. And people are free to travel, but make sure that they have the sense of hygiene and the social distancing. I think they are free to go everywhere. And in some industry, which is very hard to keep the social distancing, certainly there is some limitation on that. And the one thing that I'd like to share is that there's a big credit to the local manufacturing industry, which help us to mass produce in a very short period of time, less than 2 months, from on daily production of the facial mask, 2 million, to up to today, we have a capacity to produce more than 20 million. And the make sure that to supply the local demand and the local need, we start to, in the early part of the effort, we start to share our surplus with those countries which is better hit. I think, as I always say, the pandemic is a joint effort. It is a global cooperation. We need everyone work together, and we should leave any society or country behind. And we try to be helpful to dealing with this pandemic with everyone else. Also, that I think very important thing is that I remind my friends from time to time, Taiwan's case may not be used as a good example for every country, because each country and the society have different social, cultural, unique background. So the way to dealing with the pandemic in Taiwan is very effective. But in other countries, you have to take it into consideration of different situations. But having said that, I believe there is some lessons we get from Taiwan we can share with our friends. It might be taken as a good example, and then for reference, or see whether even for future cooperation we can work together. Because for instance, some measures that have been effectively used in this society and the country of Canada, for instance, keep the social distancing and then properly washing your hands, and also make sure that we can do the very quick the patient identification, testing, tracking, tracing, quarantine, and so on and so forth. So that's still a very important principle that we have to execute. We have to do that in the very beginning and make sure that it's not going to spread around to the society. And then for the front workers, frontline workers, they can properly to cure the serious patients. So,
Thank you.
That's the information I share with you.
Thank you very much. And I think in question number one, in all your responses, we've sort of had a hint about how your government has responded. And I just maybe wanted to take a few more minutes to just ask each of you, maybe for some of the highlights. I mean, we know that there's a public health crisis. We know there's also an economic crisis at hand in your countries. Can you maybe just highlight a couple of the policies, maybe one of the standout policies in terms of the economic response and also the public health response? How have you, what would have been some key sort of defining issues there? And maybe we can start again with Ambassador Spawas. Ambassador Spawas, are you there?
Yes. Can you hear me now?
There we go. Yeah, we got you now.
Good. Okay. Yeah, we could do a little bit what worked, what didn't work. And I think what really worked is doing things fast. Our Chancellor, Angela Merkel, who is not an emotional woman, but who's a very sober scientist, actually, by upbringing, had a very, very straight press conference at the very beginning of the pandemic, where she stood in front of the nation, and she never does those things except for at Christmas. And she stood there and said, "This is serious, take it seriously." And that has really, really had an impact. Also, the fact that she surrounded herself with a scientific council who sort of step by step took the nation, if you want, through it. What didn't work, or what we don't know yet didn't work, I think, haven't been good enough on the tracing yet. We are trying to do a lot of tracing. Germany has been very good on testing, and Germany has been good on intensive care. These were two real strengths in facing the pandemic. But on the tracing, I think Taiwan has done exceptionally well. And I know that Japan, actually, and not even digital tracing, but tracing, analog tracing, if you want, has done extraordinarily well in always finding out where the infection came from and how far it had spread, and then isolating those who might have been in contact. So that in Germany hasn't worked yet. We still don't have an app that works. Another thing that I think hasn't worked particularly well, it was a European solidarity. You know, there was a real temptation, even though the pandemic is a global one. Everybody snapped back into nationalistic kind of reflexes. And there was a moment when Germany, who is a country and should always be a country with a very strong European reflex, also did that. And at some point, we weren't exporting any medical supplies. We sort of wanted to keep them in the country, which has been something that has resonated very badly with our neighboring countries. That was something that I think everybody agrees now in Germany we would not do like that again. Another thing I would like to point out, what hasn't worked, or it's a bit like you're the victim of your own success. There is a perverse effect. The moment you are very cautious and you ask your population to really isolate and to be really distant from each other, the pandemic will slow down very seriously. That then makes a lot of people say, it wasn't as serious as this. And you have that false security. And we do have a bit of that. And we do have a bit in Germany also of these conspiracy theorists who think this is all sort of the government trying to control them more. So there's that also is, I think, something to think about it. I think we all have to know we're living a gigantic worldwide experiment, and in sociology, in economy, in psychology, and we will only know later what happened.
Thank you very much for that assessment. Ambassador Kawamura, can you maybe again single out a couple of things that have worked and some things that were maybe continue to be challenges in the Japanese approach?
Okay, let me touch upon the first economic measures. Because Japanese GDP suffered substantially during the first quarter because of the recession caused out of this pandemic. Well, Japan's economy is the third largest, and it might impact on the neighboring countries and the region substantially. So we took the initiative, and the government embarked on the huge scale, the 40% worth of Japanese GDP supplementary budget established to support the macroeconomy, and it also includes the direct support for the medium and small-sized industries. So far, we have provided a $6 billion to 45,000 small and medium-sized companies. And it also includes the cash direct payment to every single national to support their living. So this size of economic support program was the largest ever we have taken in the history. So we will see that this economic infusion, money infusion will work in the coming months. And also, we would like to underline that we need to enhance the medication systems, but at the same time, as Sabina mentioned, that the tracing mechanism. As a matter of fact, Japan is also now entering into the new technological adoption, which is called the counter cluster measures, new monitor system. So we will use the applications, new contact tracing applications for smartphones, which will require no personal information. So we pay 100% to the individual human rights, privacy. And this system will be available in mid-June. So it's one of the major pillars of Japanese reactions to the pandemic challenge. So in addition to the ongoing, as Sabina puts it, human intensive care of the infections, but I will employ the new device as well. And also the medicines and vaccines will continue to develop in cooperation with the international communities. That is quite important. Japan and Canada and other friends are providing supports towards such a collective approach. And the Medicare system, I'd like to underline that it might have worked effectively in my country. That is universal healthcare system. Well, I think Canada, Sweden, and Germany, and many other countries are well, adopting this policy for decades. But I think by analyzing the reactions, responses of the cases, but I think the universal health coverage should be on the basis of taking measures against such a pandemic. Together with the leadership in the politics and the education and awareness of the on the side of the general public, plus the Medicare systems, hospital beds and quarantine systems, and also the tracing cluster intensive measures. So with those measures combined, I think I worked. And we need to examine the case of Japan in the coming months and years, which elements worked, which elements didn't. Some people say that Japanese customs are very unique, like taking off shoes in houses or wearing masks at a time of spring to prevent the hay fever and so on. It's a part of tradition, and washing hands has been in public practice for centuries. So this may be a part of the play, but I think the crux of the issue would be more a political and policy directions, as I said before, on the basis. And another thing, as for the medical device, which may differentiate Japan from other countries, is the availability of we call it CT scanner. CT scanner is that to detect the pneumonia in the early stages. So CT scanners availability in terms of per a population and the absolute number of the CT scanner machines. Japan has the highest number of those availability of the system. So it might have worked as well. In parallel with the cluster tracing method, but at the same time, the general patients who might have problems with the lung and the coughing, they ask for doctors, and if the doctors suggest those patients will go through the CT scanner checking, and then if the pneumonia is found, then to the PCR testing. So those systems work together as well. So that's where we are.
Okay, thank you very much. Ambassador Al.
Did you say Aline?
Aline.
First of all, I would like to say that I was very impressed by the increase of intensive care units and beds that Sweden could muster in a very short period of time. That was part of the success, I think, that we actually managed to bring more intensive care units in place. We produced a lot of ventilators, and maybe that's also a little bit of the negative side of it, that we focus too much on hospitals and intensive care units and maybe not that much on elderly care centers. But still, I think we did that very well. I'm also impressed by Sweden when we had a discussion about the global supply chains, because only a few kilometers away from the biggest hospital that has most of the COVID patients, we are producing one of the most really the best ventilators in the world. And there were some articles in the media saying that they're producing this and they are sending it somewhere else. But actually in Sweden, the attitude was very much open, saying that, of course, I mean, we need some products from other countries, and if they need our ventilators, we should, of course, export them. So we actually exported, I think it was 75 of these, of the highest grade of ventilators to Canada, actually in April, and the debate was not there. So, and I'm happy that Germany had this experience, so we in the future can learn from that experience in the European Union, that in a crisis like this, it's extremely important that we keep the global supply chain open. And we felt it as well from another country very close to Canada, where producers of medical equipment didn't get the right materials from the country south of the border from here. and that's not good. We need to understand that we need to keep the global supply chains open. I already said something about the elderly care centers. I think most people in Sweden do recognize that we could have done a better job there. I think it is because the focus was so much on hospitals and not so much on elderly care center. And actually in Sweden in the beginning of the 90s, when I was a politician, because I was a politician once upon a time, we decided to move something we called sjukhem, hospital homes that was done by the hospitals, and we moved that to the local authorities that were in charge of the elderly care centers. I think it was a good move, but that's also created a view that elderly care center is for elderly people that need some care. But actually in our elderly care centers today, lots of the elderly people really need hospital care, so to say. And when everyone was looking for ventilators, I think we overlooked the problems that we have among the elderly care centers. When it comes to testing, there is a criticism in Sweden, and I think everyone agrees that the testing is too slow in Sweden. And I don't really know the reasons for it, but it hasn't been the highest priority from the beginning. I also would like to say when it comes to app and tracing even people's, where they move and who they meet and so on, I think, and that's my personal view, I think that's a total no-go in Sweden. It will never be accepted that the state will have an app to you and they will check out where you are and where you go and so on. And I actually think that is the reason why we have a very soft approach when it comes to the lockdown. Our people listen to the authorities. There is a trust to the political and to the state authorities, but there is also an enormous urgent need for have their freedom, not being told by rules what to do. They want to hear a logical explanation why they should act X, Y, and Z. They don't want any police in the corners. They don't want any fees to be distributed. They don't want the state to tell them exactly what to do. So I think that is also a lesson for the future for us in Sweden, because it has absolutely some positive effects, but also some negative effects. And maybe we will learn from that longer down the road.
Thank you very much, Ambassador. Representative Chen, what can you highlight in the approach of Taiwan that is also a good lesson for other countries in terms of the approach? And was there anything in this early stage of looking back that has been viewed as more challenging?
I think that if I could start with the challenge is that Taiwan's proximity to China is somewhere around 90 miles, and the millions of tourists coming from China each year, and we have 1.5 million business people come and go from China, and so I think for pandemic, I feel that we are very confident we can dealing with it. As I always say, we do the right thing on the early stage, so we can put our energy and resources to the right place, and the frontline worker can be well protected. They can do their thing they are required to do, and I think for the come back to the economy, as I can imagine, pandemic, this might not be the last one. So it will come back probably, maybe again. So how could we possibly to establish a national team for each country to prepare for the stockpile of the PPEs during the difficult times? I think that's a challenge for every government. My government have paid very much attention to. I think after this, for the biotech industry, for sure, information technology industry, and that will certainly continue to be our priority industry. And I just mentioned about how could we ramp up the PPE stockpile in a very short period of time. it requires that constantly you coordinate with the local industry. And how could we do that properly? And the ambassador of Sweden just mentioned about that. I raised that issue earlier also. The civil liberty. I think for a country, for a democratic country, dealing with this big challenge, why it's different from the others is because we respect people's life. In the meantime, we have to respect their will. And then how could we properly to make it a balance? And then you continue to get the trust and respect of the people. I think that's a challenge for every leadership in the government. And look at the Taiwan, I think transparency and it's a very important policy dealing with the pandemic. The leadership make sure that when they are going to implement a major mechanism or the policy which will be affected people's freedom or movement, and even a small group of people, they have to communicate with the legislator, with the citizen, with the NGO, make sure they realize that's for the public good. It's a big challenge. I think for every country, it's always people have a different opinion. We have to respect that. But how to effectively to implement the policy, that's also another, you have to balance in both. But I think look at the case in Taiwan. I'm very proud to share the story, which might not be a good example for everyone, but at least it's still have the value which deserve people look at this example and then maybe can learn some part of it. And when next time, or even we are in the middle of the pandemic, we can properly to use some of the good method and then try to flatten the curve as possibly as we could. And I listened to the three ambassadors' good story, and I think for us we can also learn from your good stories and make sure that when we fix in this or next pandemic, we can well prepare. Thank you.
Thank you very much. And I see Andrew Cardoza has appeared on the screen, which means that I think we're into the question from viewers round. So I am going to go silent. And Andrew, please, the floor is yours.
Thank you very much, Michael Levitt. There have been a number of questions, and I'm just going to boil it down to two questions, and I'm going to ask each one of you to be very brief in your answers, if you don't mind. So the first question is, which country's performance do you admire beyond your own? And the second question is regarding what is often referred to as the she session or the she recession. So this is being called a she session because of the dramatic impacts on the service sector jobs where women predominate, and also on the family and home front. So how do you see, in terms of recovery, your countries focusing on these workers, on women, in terms of better wages and affordable childcare? So just a quick comment from each of those, and I'll start with you, Ambassador Esparwasser, and apologies again that we haven't been able to get the visual of you on screen, but we can hear you perfectly well.
Thank you so much, Andrew. Do you hear me now?
Yes, indeed.
Great. Which countries do we admire? There are quite a few countries who've been doing very well, and we've just listened to what my colleague Jazz from Japan and our colleague from Taiwan has described. These are very impressive results. I would add results of New Zealand. They sound like very, very impressive. And so I think these are lessons to take. Maybe also island states can do it better than others. I would be tempted looking at Taiwan, but maybe some other countries too. Countries with women leadership have done pretty well. actually. And that brings me to the she session, and thank you, Andrew, for mentioning that. This is a real issue. Women are going to be affected much harder. They are harder affected during the crisis, and they're going to be harder affected after the crisis. I believe we have to make sure that this is not bringing sort of women's liberation and emancipation back and turn the clock back, absolutely. We also need to look much, much more at wage equality for jobs that are traditionally being held by women, namely like nurses, caregivers, people who work in the care of old people.
Okay, thank you. Ambassador Arlene.
I would like to say that I think this virus will be all over the world as a pandemic for a long time to come, and it's really hard to know, which country is doing the best. But for now, I would say that I would like to compare Sweden with our Nordic neighbors like Norway and Finland and Canada, because these countries are so similar to us in many other aspects, and they have so far, I underline that, so far, handled it much better than Sweden if you count people that have been infected or people that have died from COVID-19. So even though our societies are so similar, they have taken another path, and as it looks now, they have much less death from COVID-19 than we have in Sweden. I would like to though underline that it's so far. We don't know what's going to happen when we open up, and when the next phase of the first wave will hit us, or when the second wave will hit us. But it's interesting to see that so similar countries like the Nordic can have so different approaches with so different results so far. When it comes to the elderly care centers and affordable childcare and so on, I don't think I'm surprising anyone saying that I think we are having a very good childcare system in Sweden, which is affordable for everyone that is working in Sweden. And absolutely, they are low paid, the people that work in the elderly care center. The work schemes are too bad, and I think that is one of the reasons why we have such a spread in the elderly care centers, that they go from one center to another. They need to work with a lots of elderly people, a lots of seniors. So it's a very stressful job, of course, and low paid. And I think there will be a lots of focus actually on issues like this in the future, because think about all the frontline workers, all the people that we have been applauding all over this period. They are not really the heroes in the news magazines or in the newspapers or on the evening shows. It's more about, other categories of people on the financial business or actors or, something else that are heroes in our societies. I think, and I personally really hope, that we will remember who we really wanted to do the job when this pandemic hit us.
Yeah, thank you, Ambassador. Ambassador Kawamura.
Yes, thank you. Well, I think today's attending ambassadors, all those countries and representatives, I think they are all leaders. We learn from the president good examples day by day, minute by minute. In Japan, we follow very closely. So we learn from each other, share useful experiences. And so each one of us is part of the game towards the new normal. And the new normal affairs, I think each country is entitled to be a hero or heroine, but at the same time, we work together so that the whole picture of the new normal world will be very innovative and healthy for every one of us. So the key for the future seems to be for us is the collective and innovative. By saying collective, I think on 3 fronts, the development of vaccines, the development of medicines, and PPEs, supply chains. We have to address those imminent issues. So we will continue to collaborate on these front lines. But our Prime Minister is now suggesting that the establishing a new network of like-minded countries, with the democracy, freedom, and the rule of law. Those are fundamental values seekers would be united and establish a transparent system of sharing the property rights concerning vaccine and medicine development. So the upcoming G7 leaders meeting, Prime Minister Abe said that he would propose to establish such a property rights pool for those development. That's one of the future directions. So we need to collaborate in the coming months. And the ladies, female frontline workers, I think we have the similar challenge in Japan too. We need to pay the same amount of attention to protect, support those frontline people by sharing the experiences of other countries. Thank you.
Thank you. Representative Chen, sorry, we're running over time, but please go ahead.
Yes, I think I totally agree, Ambassador of Japan's comment on. I think at this time, no one is a winner unless we can work together through our joint effort, and we can, properly threaten and dealing with the pandemic, and we can say we are doing a good job. Until then, I think we should continue to develop the vaccine and then try to adjust to the new normal, get back to the society, keeping social distancing, and keep the momentum of the economy, make sure that no one is going to get hurt further. And I think also very important is that after the pandemic, we have to restructure our supply chain. We have to reorganize our economy. I think that's a big plan for everyone, and we should prepare for that. And I think that's even important before our formal challenge. And for the females, frontline worker, I think in our country we have big challenges. Society getting older, and we have a small family, and how could we properly to dealing with a difficult situation? I think we learned a lot from the country like Canada, and because just 20-some years ago, our society was still very young, but just a very short period of time, we become much older, and then this one of the old society in Asia. So how could we address to the issues? Well, certainly we can learn from Japan, from Germany, from Sweden, and from Canada. Yeah, thank you.
Thank you. Before I turn over to Michael Levitt for the last word, a couple of words of thank you. First, thank you to Ambassador Aline, Ambassador Kawamura, Ambassador Sparwasser, and Representative Chen for sharing this time with us. Boy, we've covered a lot of issues. In some way, we've just skimmed the surface, but it's really fascinating to hear your experience and hear some of the things that are quite different and others which are quite similar. I want to remind viewers that we have another webinar planned on this series with ambassadors from Africa and South America, very much on the theme of the summit that is happening this Thursday, that's being hosted by the Canadian and Jamaican prime ministers with regards to COVID in the developing world. We also have a webinar on Monday coming up, next Monday at 2 p.m. on long-term care in Canada. I hope you'll join us for that. By the way, you can see any of these webinars on our YouTube channel. So just go to YouTube and type in Pearson Center, and you'll see all these videos. Thank you again to our sustaining sponsors, CBTU, IAFF, and over to Michael Levitt. Michael, thank you very much for moderating today. You run a very influential and important committee of the House of Commons, and it's great to have had you today as part of this discussion and moderating. Over to you.
Well, thank you very much, Andrew, and thank you to the Pearson Center for putting on this program, and to hear that you've got so many other really interesting webinars coming up. This is great work at a time when we need to have this information. We need to be getting this information and these discussions out and live. I've heard it from all four of our esteemed guests on this panel today, and I think my concluding remark, because I know we're already 5 minutes over time, the importance of taking an international approach as we deal with the now and what lies ahead in the future. It's going to be even more important for countries like Canada and Germany and Japan and Sweden and Taiwan, like-minded allies that share so many common values, to be working together, whether it's on international development, whether it's on the economic recovery, on public health, on development of vaccines. The need, as we see other countries in the international sphere pulling back, we know that these like-minded allies, we're going to need to be collaborating even closer, relying on each other, and learning lessons from each other, which is exactly what we've done on this webinar today. We've heard about the different approach from our allies, and these are lessons for Canada. The point was made at the very beginning that in many cases, these countries are a couple of weeks ahead in the curve of Canada. And so important that we're listening to and understanding each other's particular strategies as we plot again the near future, the intermediate, and the longer term. But to each of the four of you, thank you so much for the work you've been doing. Again, I know it's not easy times for you in Ottawa. You're not back home. That must carry pressures as well. But thank you for joining me, my first time moderating a panel like this. Thank you for joining me and for such an intriguing and interesting discussion. Andrew, once again, the Pearson Centre is doing great work, and I look forward to tuning in as just a spectator on a couple of the upcoming sessions. Thank you.
Well, thank you very much.
Thank you, everybody.
Thank you.
Thank you.